below the bottom of the photograph.
In fact, as you were examining Mr. Diesel, it looked like he would have been lying on his back.
That's correct.
With respect to wound A, what observations did you make as to that particular wound?
So that wound is, obviously it's on the left side of the chest, and it's about 20.5 inches below the top of the head and 5.5 inches to the left of midline. It's 1.25 inches long.
I'm sorry, when you say left of midline, just so we're defining.
Oh, I'm sorry. So midline is a plane, an imaginary plane through the middle of the body like this. So left of midline is, it's always with the decedent's point of view. So this is to the left, that is to the right.
When you talk about locations on the body, you're always talking about it as if it were the person in question.
It's from the person's perspective, yes.
All right, I'm sorry to interrupt you. Yeah, you mentioned the size of that wound.
Yes, so that is 1.25 inches long on the skin surface. The edges are a little bit dry. There is sometimes you can see a blunt edge, a blunt end, or a sharp end on the edges of the stab wound. But in this case, the edges are dry and it's hard to determine. So I can't say whether one end is blunt or one end is sharp. After going through the skin, the wound continues through the space between the 4th and 5th ribs on the left, which is called the 4th intercostal space. It then traveled into the left ventricle, which is one of the areas of the heart, and into the interventricular septum, which is another area of the heart. The overall depth of penetration was roughly, and it's always a rough determination because of the compressibility of the body and the fact that in life the person's breathing in and out and the chest size changes. So it's an estimated depth of penetration of 4 to 6 inches.
You mentioned that interventricular septum. Is that divides the heart?
That divides the two lower chambers of the heart. So it's just another part of the heart.
And in terms of the directionality, if you will, of the wound, were you able to make some estimation as to the directionality?
Yes, it was basically completely left to right, without upward or downward deviation, and without much forward or backward deviation. It was left to right.
And again, so as the point of view from the person's body, from the person's left side toward the person's right
side. Exactly.
Did you make any observations of the lung in and around that area of that wound at the time that you examined it internally?
Yes. So the left lung within the chest wall. Usually the lung is pressed right up against the ribs, and there's no space between. There's just a small amount of clear fluid that lubricates the area, and that forms a kind of a vacuum seal, such that when the muscles of your chest come out to breathe, the lung expands and air comes into your mouth and fills the lungs. When there's a wound to the chest, when your ribs expand to breathe, not only can air come in through your mouth, but it can also come in through that hole that's been made in the side of the chest. And that can cause the lung to collapse. And it can cause blood to collect in that area, as well as the wound to the heart can cause blood to collect in the chest cavity as well.
So just in terms of the lung itself, what was its condition or status?
It's what we call atelectatic, which means that it is collapsed.
And did you make observation of blood in that particular cavity area?
Yes, there were at least 200 milliliters of blood. There was by report and in the police reports there were